In our medical news this morning, the White House tapping a close ally of Health and Human Services Secretary Robert F. Kennedy Jr. to lead the Centers for Disease Control and Prevention. That announcement comes a day after the previous CDC director was forced out. Jim O'Neill, the Deputy Secretary of Health and Human Services, will serve as acting CDC director. During his confirmation hearings, O'Neill insisted he's pro-vaccine, but he also said the federal government overreached during the coronavirus response. Time to check your fridges once again. Another shrimp recall to let you know about. Aquastar is recalling more than 26,000 pounds of its 6-ounce shrimp cocktail. The product may contain cesium-137. That's a dangerous radioactive substance. The FDA says the affected shrimp were imported from Indonesia and sold at Walmart. The product was distributed to nearly 30 states between July 31st and August 16th. Nearly 1 in 4 U.S. adults report living with chronic pain, according to the CDC. That means the pain has lasted for 3 months or longer. While it can significantly impact a person's quality of life, many may not seek a doctor's care out of fear of being told that surgery is needed. Mandy Gaither explains why one expert says surgery should rarely be the first step.
When you're dealing with chronic pain, just getting through the day can be a struggle.
It just prevents them from working, prevents them doing a lot of the things that they like to be doing.
Dr. Brian Braithwaite with Orlando Health Spine Center says instead of seeking care, some may try to deal with the pain, fearing they'll be told that surgery is the answer. But he says that's not always the right one.
Surgery is kind of that last resort. And if you look at statistics, most patients get better. And I'd say probably greater than 80 to 85% of patients with chronic pain get better without ever needing surgery.
Braithwaite says the first step for patients with chronic back and neck pain is to get to the root of the problem. That starts with an x-ray to look at the alignment of the spine. If more information is needed, advanced imaging like a CT scan or MRI are then performed. He says treatment options will vary based on the diagnosis, but could include chiropractic care, massage therapy, dry needling, and acupuncture. For aches or a sprain, he says anti-inflammatory medicines like NSAIDs or other over-the-counter medications could also provide tremendous benefit. And if the pain is keeping a patient up at night, he says muscle relaxers may help.
Quality night of sleep is very important when you have chronic pain because we do want the body's natural mechanisms to kind of kick in and provide some benefit there from a health perspective.
The doctor says if a patient is taking over-the-counter medications at home and their pain isn't getting better, that's a sign to seek a medical provider.